Have you found yourself overwhelmed by the Medicare plans and choices, wondering which path to take for yourself or a loved one? Today, we are diving into the world of Medicare with our expert guest, Dr. Ara Sayabalian, who not only brings his Harvard Medical School background, but is also spearheading programs in the senior living industry. In today's episode, we're here to help you navigate all the information of Medicare plans, translating healthcare lingo into everyday language that everyone can understand. Today, we explore Medicare and how it provides healthcare coverage for older adults, the key differences between Medicare Advantage plans and fee-for-service Medicare, how the plans work, what benefits are typically offered. It's about finding the best path to navigate for yourself and your loved one amidst all of the noise and confusion out there. There is a lot to unpack, and this gets us started. So whether you're a caregiver, an older adult, or someone trying to make sense of Medicare, join us on this episode as we hopefully provide some of those answers that you are looking for. Here is my interview with Dr. Ara Sayabalian. Hi, Ara. We get to have a conversation about something I think that causes a lot of confusion and questions for people. So thank you for bringing your expertise. Thank you for joining me today.
Very happy to be here.
Yeah, there's so many questions I think families have and older adults around Medicare, Medicare Advantage. We'll be releasing this around the time when there's that open enrollment period. So it's really perfect timing for us to talk about that and just dive into what it is. But before we do that, I want you to tell us you are very well educated and have a heart and a passion for the senior living industry for older adults. You're applying this knowledge in a lot of different ways. Share with us a little bit more about your background.
So, my background is relatively unique because I have had experience working with seniors and developmentally disabled individuals in a variety of capacities. And it started out when I was running a company that was essentially manufacturing and incontinence products. And incontinence is not an area of care that many people want to talk about, but the reality is it affects millions of people. So I found it that if not me, then who? Who's going to educate a lot of these individuals on whether it is different exercises, different types of therapies, different types of products out there that would ultimately help their quality of life. So with my background, I have a doctorate in continence education. I got that from University of Southern California. I got my MBA as well from the University of Southern California. And just recently, I graduated Harvard Medical School's Masters of Clinical Services and Operations. And in a nutshell, what that is that it talks about how can we deliver to the patients of America the best quality of care at the most effective and efficient price points. And that has led me to an area of care, which is Medicare and Medicare Advantage plans that people have a lot of questions on. And frankly, the more you dig, the more you learn, the more questions that you come up.
Yeah.
And hopefully, after this podcast, people will look at it and say, I have a better foundation and understanding of Medicare so that I can ask better questions,
Mhm.
if that makes sense.
It does. And it's so important. We feel so empowered when we have information. And I think a part of that is knowing the right questions to even ask. And as a disclosure, both you and I are not tied to Medicare or Medicare Advantage in any way. So we're not incentivized in any way, but we just want to be able to offer that information when people have questions.
Yeah, and everyone has a loved one who's over 65. When you talk to that loved one, you realize how lost they are and how they are kind of just going with the flow. And knowledge is empowerment, and asking the right questions is also empowerment as well. So that the person that you're talking to, whether it's your physician, whether it's your provider, whether it's your physical therapy provider, the hospital you go to, you come at it from a place of strength instead of just saying yes or accepting the way things are.
So, how would you explain what Medicare is? How does it provide health care coverage for older adults in the United States?
When somebody turns 65, they're eligible for Medicare. Medicare ultimately means that you have now reached an age where the government will subsidize a portion or a very large portion or almost all of your health insurance. And that's ultimately why Medicare was created.
Mm-hmm.
Once you turn 65, you have insurance. And Medicare has evolved over the years as far as the types of programs they provide and the coverage they provide as well.
Would you say that there's confusion about what options are even available? We've got Medicare fee for service, and we also have Medicare Advantage plans. Is that correct? You're the expert. Yep. And how would you explain the differences between those two plans?
There are a few other carve-outs, but
Mm-hmm.
for simplicity's sake, there right now the most important divisions, okay, or areas of Medicare that people are trying to understand are Medicare fee-for-service
Mm-hmm.
and Medicare Advantage plan. I am going to add one thing before I get into the explanation, and that is until somebody starts to truly understand the benefits of Medicare, they do not know. And 9 times out of 10, families are very surprised at what is actually covered and what they thought was going to be covered. And that leads to a lot of stress. I'll give you a quick case study or a quick example. My mom, my dad, my loved one who turned a senior, I think that everything's going to be covered under the sun once they turn 65 because now they have Medicare. And then they go to the hospital or they have a procedure done or they need certain services. And then I come to realize that many of these services are not covered. So that's an area of stress that a lot of people go through
Mm-hmm.
based on the perception of what's covered and what's actually covered. So Medicare fee for service ultimately means that you have the opportunity to go to a physician, a provider, see them, and then they will charge Medicare a fee for their service. That's typically also called traditional Medicare. When Medicare was created, that's what was created, the traditional fee for service, where somebody's able to go and see their doctor, nurse practitioner, physician assistant, and get the service that they need. With Medicare fee for service, there is a supplemental amount of money that that individual has to pay. It's called supplemental. And what that means is the government, Medicare fee for service, is paying a certain amount of money for that insurance, but you, as the beneficiary, as the Medicare recipient, as the person that's over 65, has to pay a certain amount of money per month as a premium. Medicare Advantage says that we're going to provide services. We're going to provide additional services that regular Medicare fee for service does not provide. And the big ones are eyes, ears, dental, vision, and hearing. Okay, those are the three big ones. And Medicare Advantage says for a very low premium, or actually oftentimes zero premium, you will get all the benefits of quality care with a wellness approach, an approach to longevity. And there's a lot of talk these days about longevity and wellness and emotional well being and not only physical well being, but mental health, right? Mental well being. So the biggest difference is with Medicare Advantage, you have a choice of providers that you can choose from. And you are not necessarily allowed to go to a provider that is not in network. Medicare Advantage has several different individuals, hospitals, therapeutic areas, for example, physical therapy, surgery centers that have contracted with the Medicare Advantage plan. And if you are in that Medicare Advantage plan, you are allowed to go to those particular individuals.
Okay, so Medicare Advantage, you need to find a provider that's in that network, so to speak. And the key difference then also would be that wellness and longevity piece and covering some of those options.
Exactly.
Okay, okay.
Exactly. Now, The one thing when Medicare Advantage plans started was a lot of the seniors saying, "Well, I want to go see my doctor. This doctor is not in my network." You heard that a lot. But as time has gone, there are many more providers in the Medicare Advantage networks. So you have a much larger choice. And that um, pain point, quote unquote, isn't as painful anymore because more doctors, more physician assistants are in network than not.
Got it. Okay. And so with Medicare Advantage, when did this plan come out? How new is it to us?
You know, the plan has been around for a long time. The Medicare Advantage concept has been around for over 20 years. However, what's happened over the years is that the Medicare Advantage plans are offering more services than regular Medicare fee for service. The Medicare Advantage experiment is, and I put that in quotation marks, right, is working. People are enjoying Medicare Advantage plans, especially because of the premium. And especially because with Medicare Advantage plan, I know that the worst case scenario has a monetary cap on it. And that's really important. With Medicare Advantage is saying the most you're going to pay out of pocket is a certain amount of money for hospitalizations, worst case scenario, chronic illness. With Medicare fee for service, that's kind of unlimited. So what that means is if you're on a Medicare fee for service, not only are you paying a premium per month, but you are also taking the risk of a lot of out-of-pocket cash.
Got it. Okay. So those are some of those advantages and then disadvantages to choosing either plan.
Correct.
And how do you know what plan is right for you? Is it, do you look at your health status? Is it based on your economic capabilities when you're deciding what's maybe best?
So like you said earlier, usually for Medicare Advantage plans, the open enrollment is October 15th. You are able to enroll and choose a plan once a month, I'm sorry, once a year, and you're enrolled in that plan for the entire year. So in that period of time, you can research the Medicare Advantage plans that are available in your state or available in your city and look at the services that are offered and the premiums that go along with it.
Mhm.
And oftentimes, I find seniors looking at it starts with the doctor's office and saying, okay, which Advantage plans does my doctor accept? That's as a start, right? And that affects which plan that they would want to choose.
Mhm.
However, I'd encourage all seniors, all loved ones of seniors, all family members to dig a little deeper and open yourself up to all the potential services that are available through the Advantage plans.
And when would we want to look at the Medicare? What you say is that traditional or fee for service? When does that come into play when we're kind of weighing those two different options?
Well, if I would say that economically, if you have absolutely no care on how much you're going to spend on Medicare, you not care about the amount of risk monetarily that you'll be on the hook for, then you can do Medicare fee for service, where it allows you to go to any provider at any time without prior authorizations.
So it really is so individualized based on our needs and where we're at.
It is. It's very individualized, and I think with the pandemic, it changed the mindset of a lot of people, and that's primarily why that in January, nationally, Medicare Advantage plan lives surpassed Medicare fee for service lives. Yep, because people started seeing, wow, this can really kind of get out of control, the amount of money that I have to pay out of pocket. And if I am coming back to knowledge is power. If I'm knowledgeable enough about the services provided for Medicare Advantage, then maybe I should just join the Medicare Advantage plan because then I'm not going to be on the hook and at risk for all this money.
I was going to say, I know some questions I've heard people broach are maybe the concern with Medicare Advantage is that you're not able to maybe have access to the care that you would need or the availability, but that probably comes back to your needing to be in network. Is that where that connection is?
So there's a lot of that kind of mindset where people say, I don't want to be in a Medicare Advantage plan because I'm not allowed to go wherever I want, whenever I want, however I want. At first, I'd like to dissect that
Sure.
and say, in regards to emergency room services, urgent care needs, regardless of Medicare fee for service or Medicare Advantage plan, you are able to get the service.
Mm.
So, in an emergency situation, it's never going to happen where the hospital will not take you in as an inpatient based on the type of Medicare you have. So, in an emergency situation, not an issue. The prior authorization is something where Medicare Advantage plans utilize in order to control who is seeing what type of provider and who is seeing what type of needs they need. And they are essentially saying you'll be able to see anyone you want, but we want to know why. If you want to see a specialist and you need a prior authorization, because prior authorizations get a bad rap. If you need to see a specialist, we simply want to know why, so that we are not unnecessarily having to pay out the specialists when you don't really need to see them. Would you like an example of that?
I would explain. That would be great.
So ultimately, in Medicare Advantage plans, it is the priority of your family practice doctor, your internal medicine doctor, to keep you healthy. That's their goal. Their goal is to provide you with medications, prescribed medications, etc., to keep you healthy, both emotionally and physically. If you need to see a specialist that is outside of the scope of practice of the internal medicine doctor, you need to be referred to well, let's just say a cardiologist, right? So, in order to see the cardiologist, you probably need a prior authorization on the Y factor. That prior authorization will be written by the internal medicine doctor's office, submitted to the Medicare Advantage plan, and based on what they write, that prior authorization will be approved, and then you'll be able to see a specialist. And that can be a cardiologist, neurologist, nephrologist, based on what type of specialist you need to see.
It helps to have that explained a little bit further, right? We can put ourselves in that situation. Are you finding that when people sign up for a plan, maybe they don't like it, can they switch back between the two, between whether it's Medicare, traditional Medicare, or Medicare Advantage? Are they able to make that change each year, or are they kind of locked into one plan for a long time?
Excellent question. And the answer is you can toggle and switch between fee for service and Medicare Advantage plan.
I bet that alleviates some concern, right? You're not
It
stuck in
does.
something. Yeah.
It
Yeah.
does because you try it out for a year, and after a year, you say, this isn't really for me. Or you say, you know what? This is good. There's actually benefits to this plan that I didn't have with Medicare fee for service, and I get to see my doctor, and I get to save a lot of money that I can potentially spend on other things that I want in my golden years.
Right. And the enrollment period, is that the same for both Medicare Advantage and traditional Medicare? Is it that October 15th date?
Yep, it
Okay.
starts on October 15th, ends middle of December, and that is for all Medicare recipients with carve-outs. There's a carve-out called institutional special needs
Hmm.
that ultimately is for individuals that have special needs plans. And that can go for residents such as dementia residents. If a resident has three out of the six daily needs help with three out of the six daily activities of living,
Hmm.
they will then be eligible for a special needs plan. Not to get into the weeds too much, but if you are eligible for a special needs plan, and I bring this up for the senior living residents that live in senior living homes,
Hmm.
they are able to switch plans on a monthly basis.
Oh, so helpful. And our audience is comprised of also a lot of caregivers that are caring for loved ones. Explain some of those benefits that can help and offer that support to help care for the people in our lives.
My biggest ask to all those caregivers is spend an hour and find out what Medicare Advantage plan the person you're caring for is in, and what are the benefits of that plan. I'm just going to throw out a few things that are offered by many Medicare Advantage plans that maybe caregivers did not know about. One thing, for example, is transportation. 44% of the Medicare Advantage plans today offer transportation. Think about what that does from a caregiving standpoint. Not only now you can focus on caregiving instead of focusing on, am I driving? Am I driving while there's a challenge with the person I'm caring from? Another one is meal benefit. 78% of plans offer a meal benefit. I'm not going to get too into detail what that means because it differs based on the Medicare Advantage plan. But think about it. If a Medicare Advantage plan is actually helping you with your meals, that can mean shopping for your meals. That can mean delivery for your meals. What's the amount of time you're going to save as a caregiver? In-home support services. 17% of the Medicare Advantage plans today offer in-home support services down to bathroom safety devices. So the point is that I think there's a lot of benefits that are left on the table simply because of the fact that there hasn't been enough education and understanding of what exactly that Medicare Advantage plan is offering.
Right. When you don't know, then you can't take advantage of that. Yeah.
And it's in the best interest of the Medicare Advantage plan for that recipient to take advantage of it. Because the way the Medicare Advantage plans work is they want to keep you as healthy as possible. So the Medicare Advantage plans are vested in your wellness, in that senior individual's wellness, whether they are living at home with a caregiver, assisted living, senior living, dementia care. It's irrelevant. So they are providing these services, remote access technology, okay, remote access products, so that they can actually monitor and see what's happening if you have a heart issue. In-home support services, bathroom safety devices, telemonitoring, even acupuncture. These are all benefits that Medicare Advantage plans offer so that they keep you well. And I feel that it is our part to be educated on that and understand what's being offered.
Does the traditional plan offer some of those same things as well? Or is it an added fee based on the need?
So with the Medicare fee for service, many of the benefits that are offered through Medicare Advantage plan are not offered through fee for service. So there's a big gap in a holistic approach between Medicare fee for service and Medicare Advantage plans. And many, if we're talking about being an educated consumer, because ultimately that's what it's coming down to, the senior, the loved one, the caregiver. If you're an educated consumer, you are choosing which product to purchase or to enroll in. And many of the Medicare Advantage plans have a care manager. A care manager is your point person where they can walk you through a lot of the benefits that are available for the Medicare Advantage plan. They have representatives at health fairs. They have representatives that are regionally based that an individual can call and simply learn about the Advantage plans so that the senior has a better understanding of what Advantage plan to choose and whether even a Medicare Advantage plan is right for them or a fee for service is right for them.
We've talked about caregivers in the home. How about people that are considering moving into assisted living community, senior living community? What options or benefits are available for that stage of life?
Several, because I think that there's complete alignment between an assisted living community and a Medicare Advantage plan. And my opinion is the alignment is based on wellness and longevity. There's been a lot of talk these days, like Peter Attia. He's a doctor that talks a lot about longevity and talks about wellness. I find that the goal of the assisted living communities are to keep you well and healthy. The goal of the Medicare Advantage plans are to keep you healthy and well. So there's a synergistic effect where the assisted living community almost becomes a hub of wellness. It becomes a hub of wellness where several of the residents are part of one Medicare Advantage plan. And that Medicare Advantage plan is now sending over a podiatrist. They're sending over an acupuncture person to treat those residents inside the assisted living community. So by reaching out and partnering with the Medicare Advantage plans, I think that there's a synergistic effect where the community itself becomes a hub of wellness, utilizing a lot of the services that the Medicare Advantage plans offer.
There's so much conversation, you're right, about wellness where we're positioning ourselves in senior living to be that place of purpose, fostering wellness, that lifelong learning, education, and being supported in that. So it makes sense that that would tie in together.
Yeah, I think so. I think that we're on the cusp of something great. And those senior living communities that see this as an opportunity to improve wellness will do very well because the infrastructure is there. The fact that there are so many lives in a building that can benefit from the remote access technologies or the telemonitoring services that are basically free. We all know about the workforce challenges. We all know about the resource challenges in senior living, assisted living, that entire industry. And why not utilize some of these resources that Medicare Advantage plans provide from a more scalable approach?
Right. Are you finding that the senior living communities are initiating, implementing some of those benefits, or is it up to the family to figure out what's at their fingertips, whether it's remote technology or, all of the different things that they could be using? What are you seeing in that space?
I often see that a senior living community has certain ties with the therapeutic providers, with the uh, mobile physicians, so that ultimately what they're looking for is scalability. What they're looking for is partnering with different entities that can come in and see several of their residents. And by default, I think families should just open up and see what is going on. If they're constantly seeing, for example, a nurse practitioner in a building that's being sent by a Medicare Advantage plan, and that family member is driving in once a week and driving their loved one to a doctor, maybe the family should kind of take a step back and ask some questions about, wait a second, how can I be a part of this? And then what starts to happen is it almost starts to build upon itself. You're scaffolding in a case like that where the family realizes, why am I making myself do all of these things? I'm spending money on gas to transport. I have to take a day off because I have to take my mom or grandma or loved one to the doctor's office for an appointment. Maybe it would make sense if I took 15 minutes and learned a little bit about relationships that the senior living community has. And maybe that is an opportunity for my loved one to be a part of that hub and be a part of that hub of wellness. So I find that the conversation needs to go both ways.
It's a good perspective, right? We need to be invested and have an awareness, right? And I always say, and when I hear from families, they do view themselves in that caregiver role, even though their loved one is living in a community. There's still a lot of
Absolutely.
oversight, a lot of oversight that goes on, for sure, for
There
sure.
is there really is a lot of oversight, and the oversight can be more of a hands-off, higher level oversight once you realize some of the benefits that are out there.
So, as we end our time today, how would you encourage families, or what last piece of advice or wisdom would you like to impart on them as we talk about? And it's a complex topic. I think a lot of people get overwhelmed by it, but it doesn't have to be. I think you explained it so well, the different options and differences, at least to give us a starting point.
If I were to talk to a family member that is looking to get a better understanding, the first thing I would do is, first of all, thank them. And I come from a place of gratitude that at least their loved one has somebody that's batting for them, if that makes sense.
Yeah.
Their loved one has somebody that is doing the research and trying to help the senior live the life that they deserve.
Hmm.
So, first of all, thank you. Secondly, I would say just take some time perusing And it's okay to feel overwhelmed because it's overwhelming. And that's the advice that I would give. I would say feel comfortable in feeling uncomfortable with all this stuff
Mm.
because it can get very confusing, very overwhelming very quickly. And the first decision you make or the first shiny object you see isn't necessarily the best one. So stay in it, stay in the uncomfortable zone for an hour or two or three, and truly understanding how you and your loved one, who's a senior, would benefit best from the what the Medicare Advantage plans can provide. Is this something we need? For example, coming back to transportation. If transportation is not an issue, then you don't really want to look for a Medicare Advantage plan that provides transportation, but you want to look for something else in a Medicare Advantage plan. But if transportation is a biggie and you tell yourself that, you're a home caregiver and you don't have the time for transport, then that's going to go higher on your priority list. So the advice I would give is it's okay to feel uncomfortable. And I think the first step is prioritizing what's important to you.
Where do you recommend people go to learn more? Is there a spot that you like to direct people to?
The Center for Medicare
Mm-hmm.
Services is very helpful.
Mm-hmm.
And I would start with the Medicare Advantage plans that are available in their area.
Mm-hmm.
Every one of those has a collateral piece that gives you a high level benefit. And I think that if you take a look at that, set an appointment with their representative. These Medicare Advantage plans are more than happy to speak with you. Trust me, because they ultimately have a product that they are trying to sell to the community.
Mm-hmm.
Okay. And we, as seniors, as advocates for seniors, are ultimately the consumer. So once you start looking at it from that way, imagine you're going to purchase a product. That representative is going to explain all the benefits of the product. And while you're talking to the representative, ask all the questions you have. It's a great place to start.
And where can we learn more about you? Where can people connect to you and your work and and know what you're up to?
The best way to get a hold of me is on LinkedIn, and you'll see about the work that I'm doing in an area of care that is not often spoken about, but it is in the area of incontinence and improving the quality of life of the individuals that we serve. And the website to learn more about that is tim care.com. And that's an informational website.
That sounds great. Thank you. We'll direct people there. We'll have the links on the podcast. They can go and learn more. And I think incontinence is something that you're right. A lot of people walk through. And so it's important to be able to have the resource to support that.
Absolutely.
Thank you. This was great. I enjoyed our conversation and I learned some new things today too. So I appreciate your time, your expertise, and being willing to share with us all about this.
I had a great time. Thank you.
Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.